So we were just looking at some of the things that might go wrong in the digestive system. We start off at the mouth. This is where digestion begins. There are several problems that exist here. In fact, periodontal disease, if you can believe it, is the most common disease in humans. This affects about 95% of us at some time. We have esophageal problems like reflux. We have stomach problems like gastritis and peptic ulcer. We have liver problems. Incidentally, we've done a whole separate session on hepatitis. So I welcome you to go visit my YouTube channel or a couple other places that have a copy of that presentation. We could look at the gallbladder, the pancreas, the large and small intestine, lots of potential problems. So let's start to examine some of these. Gastritis. Now, this is one of the more common issues that you may run into. Many of you have had a bout of gastritis at some point or another, even if you weren't aware of it. Gastritis is an inflammation of the lining of the stomach, a tissue we call the mucosa. Acute gastritis is common, but becomes even more common as we age. In fact, some scientists consider it as part of the normal aging process. One of the most frequent causes of gastritis is generalized stress, which unfortunately most of us suffer from. Also implicated are a long list of toxins, most common coffee, alcohol, tobacco, and overly spiced foods. Certain infections can cause this as well, such as a bacteria called Helicobacter pylori or H. pylori. And finally, acute gastritis is commonly seen with pharmaceutical drugs, especially those containing aspirin or anti-inflammatories. Typically, a person would experience pain or discomfort, usually in the upper abdomen, or you may experience indigestion or what we call heartburn. Other symptoms may occur, such as nausea or vomiting, bloating, burping, or loss of appetite. So, what evidence is there for glutathione playing a role in gastritis? In this study, researchers used different amounts of alcohol to see at what levels the alcohol would cause damage to the gastric mucosa, the lining of the stomach. The higher the concentration of alcohol, the higher the amount of damage. As it turns out, the greater the amount of damage, the more the stomach tried to make glutathione levels increase. So this signifies that the stomach is trying to protect itself from damage by increasing glutathione production. In this animal study, researchers looked at the associated side effects of anti-inflammatory drugs on the stomach. And as you know, as we mentioned, non-steroidal anti-inflammatory medications like Advil or Motrin commonly cause gastritis or even ulcers. In this case, a high enough dose of these anti-inflammatory medications caused side effects. When glutathione or cysteine, as you may remember, cysteine is a precursor to glutathione, were given at the same time as the medications, the side effects were greatly decreased. So here, it's shown that glutathione is protective here against gastritis. Let's turn to something a little bit more serious than gastritis, stomach ulcers or peptic ulcer disease. Stomach ulcers are spots where the stomach lining has been completely eroded, leaving an open wound. This can even progress onto a through and through hole in the stomach wall called a perforated ulcer. About 1 in 10 Americans will suffer at some point from an ulcer, 1 in 10. They were once thought to be caused by excessive acid levels in the digestive juices, but many ulcers develop in people with normal acid levels as well. Many factors can disrupt this stomach lining. The same drugs like aspirin or anti-inflammatories that cause gastritis can cause a stomach ulcer. The same risk factors like alcohol and tobacco and spicy foods can be problematic as well. And in addition, there's that infection called H. pylori, which has been found in over 70% of ulcers. However, there are several immunological factors associated with this infection that need to be explained. The symptoms of stomach or peptic ulcer may be the same as gastritis, but usually more severe. One dangerous sign is the presence of very dark or even black stools or black bowel movements. This usually indicates the presence of blood, which is oxidized during the long trip through the intestines. This stuff is called melena. So if you see this, medical attention is urgently required. So what about glutathione in a slightly more serious condition like stomach ulcers or peptic ulcers? Just to answer a very basic question, do glutathione levels drop in cases of stomach ulcers? Well, a very good place to start from. This Japanese team looked into this. It should be mentioned that Japan has a very high incidence of gastric ulcers. The answer was clearly yes. In fact, as ulcers healed, glutathione levels crept back up to normal. So glutathione levels definitely are lower in gastric or stomach ulcer. In this study, which dates back to 1994, levels of free radical damage were measured in young people suffering from stomach ulcers. As expected, oxidative damage and free radical activity were both high, and these contributed to the formation of the ulcer. And by raising glutathione levels, much of the damage was made less severe and even eliminated in certain cases. So raising glutathione was protective against peptic ulcer disease. This would be a good time to discuss that infection called H. pylori or Helicobacter pylori. This is a bug that can invade our stomach lining. H. pylori is, in fact, a very common infection that many people carry, but some without any resultant problems. The best guess is that up to about half of our population have this bug in our stomachs. But without getting into the details of this bacteria, let it suffice to say that it is a very common cause of gastritis, stomach ulcers, and even stomach cancer. It's really very relevant to today's discussion. How does glutathione fit in here? What's the relationship with glutathione and H. pylori? Well, let's just say this has been thoroughly studied. It's been shown that H. pylori can reduce glutathione levels, and in addition, raising glutathione can suppress H. pylori. So this association is very clear. Moving on to something even more serious, stomach cancer. In certain parts of the world, this is a major killer. Cancer can appear at any place in the stomach, each with its own peculiarities, which are beyond today's discussion. It's generally accepted that ulcers do not necessarily cause stomach cancer, but cancer is often preceded by a particular type of ulcer. The incidence of cancer varies widely across the world when we're talking about stomach cancer. In Japan, in China, in Chile, in Iceland, it is one of the most common causes of death. And scientists have suggested that this is due to differences in the food that's eaten. This theory is also supported by the fact that certain occupational hazards, like working with coal or heavy metals, increases the chances of developing this disease. There's also a particular type of mold called an aflatoxin that puts you at risk. This may be present in a number of different moldy foods. So the environment is definitely something that influences stomach cancer. There are many risk factors, including many of those mentioned for gastritis and ulcers. We can add to this list, like being male or being older, a bad diet, having diabetes, having a history of stomach polyps, and more. Just take a look at this list. These are all risk factors for stomach cancer. So as you might expect, if glutathione has been shown to be related to gastritis and to stomach ulcers, then it would also have many links to stomach cancer, and you would be right. For example, there are dozens of articles that show that people with abnormalities in their glutathione genes are much more susceptible to the development of cancer, including gastric or stomach cancer especially. In other words, if your glutathione is not functioning properly, you are at higher risk of developing this type of cancer. Let's shift gears and take a look at a particularly painful entity called pancreatitis. The pancreas is an important organ with several functions, the two most important being one, to secrete digestive enzymes that help break down our food for absorption, and two, to produce hormones such as insulin and glucagon that are critical to the metabolism of sugars and carbohydrates. Acute pancreatitis is an abrupt blockage of the little duct that empties the pancreas into the small intestine. This usually happens when gallstones form and get stuck in this tube. The resultant backup of digestive enzymes start to actually digest the pancreas itself. And this can be, as expected, very painful. Other causes of pancreatitis include certain viral and bacterial infections, specific drugs, or very high cholesterol or triglycerides levels in the blood. Chronic pancreatitis, on the other hand, develops after years of repeated bouts of attacks. And the major reason for having chronic pancreatitis is by far alcohol abuse. The pain from pancreatitis is often quite severe, usually in the upper abdomen. Often it's triggered by eating a high-fat meal, which causes the gallbladder to release its fluid. When the gallbladder has stones, these stones may lodge in what's called the common bile duct, which can block the pancreatic outflow. In chronic pancreatitis, as mentioned, the culprit is usually alcohol. So here's a review of the risk factors. We see that in addition to gallstones and alcohol, there are a number of other diverse conditions, including obesity, cystic fibrosis, and others. Just spend a few seconds looking at this list. What about glutathione? Where does it play a role here? This paper here focuses on chronic pancreatitis. The authors explain that long-term exposure to certain foods that contain toxins can build up oxidative stress in the pancreas. And this oxidative stress, or free radical buildup, will eventually damage pancreatic cells and lead to pancreatitis. By the way, this word xenobiotic refers to external poisons. And as it turns out, the toxins may lead to an irreversible consumption of glutathione in what are called acinar cells. These acinar cells make up the majority of pancreatic tissue, and it is the damage or destruction of these depleted acinar cells that lead to the pancreatitis. When looking at acute pancreatitis, the mechanism is even more dramatic. These researchers describe a severe systemic inflammatory response, which means that it's not just inflammation of the pancreas, but a whole body reaction that may follow. And a key event is the release of inflammatory agents that cause severe damage and death to pancreatic cells, and the oxidative stress is a big part of that picture. And what happens is a severe glutathione depletion, which speeds up the whole process. Local damage to the pancreas may be followed by and spread to the liver, the lung, and other organs. And the author blamed redox signaling, oxidative damage, and glutathione depletion for this process. Inflammatory bowel disease is actually a group of diseases that in certain respects are similar to each other. What's consistent among these diseases is that glutathione levels are deficient and oxidative stress plays a major role. By the way, the lead author of this paper is our own Dr. Wolf Droege. Way back in 1998, he was always a leader in the field of free radical biology. But getting back to the types of inflammatory bowel disease, the two that are most common by far are 1, ulcerative colitis, and 2, Crohn's disease. Let's look at ulcerative colitis first. Ulcerative colitis is a chronic inflammatory disease of the large bowel or large intestine. It leads to ulcers in the lining of the bowel with resultant symptoms. It tends to develop earlier on in life, usually between the ages of 15 and 30 years old. It can be a single brief attack, or it can go on to a progressive illness complicated by severe blood loss or even a perforated bowel. Although rarely fatal, patients do have a higher risk of developing colon cancer. The symptoms include pain, bloody diarrhea, gas, bloating, and many other symptoms. Fever and weight loss are common, and patients may develop symptoms outside of the bowel as well, such as joint pains and even visual problems. Now let's look at some of the roles of glutathione that have been studied in ulcerative colitis. This study done over 25 years ago shows that not only is glutathione depletion part of the course of ulcerative colitis, but that the severity of the disease is correlated with the degree of glutathione depletion. Here, Spanish researchers were able to show that increasing glutathione using NAC, or N-acetylcysteine, was successful in improving ulcerative colitis patients in a double-blind study. So intervening with a glutathione elevating strategy has been shown to work. Looking at Crohn's disease, it's similar but definitely not the same as ulcerative colitis. Unlike ulcerative colitis, which only involves the lining of the intestine, Crohn's disease affects the whole wall, not just the lining. In addition, Crohn's is more widely spread, not just happening in the large bowel. It can attack any part of the digestive tract, from the mouth to the anus. It's usually more severe than ulcerative colitis. The intestine may grow extremely thick following repeated attacks, and deep ulcers may pass right through the wall, leading to a true medical emergency. And with repeated or prolonged inflammation, the intestinal passage may become narrowed and even obstructed. And as we see in this diagram, any part of the digestive system might be affected. In addition, there are effects that are beyond the digestive system. The skin can be affected, the joints can be affected, the liver might be infected. Besides pain, diarrhea, fever, and weight loss, vomiting, and decreased appetite, these patients have an elevated risk of developing cancer. The numbers are about 20 times higher. Cancer is about 20 times more common than in normal patients. And we see similar effects of glutathione on Crohn's disease as we've seen in ulcerative colitis. This Italian group showed clearly yes. Levels of glutathione were definitely affected by the presence of Crohn's disease. This is well established. And not only was it proven that glutathione levels were low, but also that raising glutathione levels can be helpful in reducing the symptoms of Crohn's disease. So there you have it. Finally, let's look at celiac disease and gluten intolerance. Celiac disease was previously called sprue or celiac sprue. The correct medical term is gluten-sensitive enteropathy. Less severe forms are referred to as gluten intolerance or gluten sensitivity. The problem here is usually a dietary protein called gluten and a component of gluten called gliadin. The gluten is found in wheat, barley, and rye. And the best way to treat this intolerance is by avoiding these foods. However, this is not that easy to do. These proteins can sneak their way into many foods where you wouldn't expect them. So when you can, carefully read the product labels. Less common causes are certain polyphenols found in fruits that can be a problem. These substances are, so to speak, toxic to certain people, which triggers an immune response in the small intestine. The immune response leads to inflammation and tissue damage. Subsequently, poor absorption of nutrients, cramps, bloating, and diarrhea. By examining the affected tissues, pathologists can see that the absorptive surface of the intestines, called villi, become blunted. The patient can go on to more serious complications, including weight loss, anemia, osteoporosis, and even lymphoma. Again, how does glutathione fit in with celiac disease and gluten intolerance? Here we have one of many research studies that demonstrate that celiac patients suffer from glutathione depletion. In fact, in this study, the scientists described a significant malfunction of the glutathione redox cycle, with a concomitant decrease in the capacity to regenerate glutathione to combat lipid peroxidation. That was a mouthful, but in other words, it led to a downward spiral in the degree of damage. This study from Italy goes on to say that measuring glutathione activity can be used to follow celiac patients in regards to their status. That is to say, glutathione levels are corrected with the degree of severity of the disease. And the worse the disease, the lower the glutathione levels are. As the disease gets better, the higher the glutathione levels. So just to review, We've looked at different stomach diseases, including gastritis, stomach ulcers, and of course, stomach cancer. We've seen that glutathione is involved in detoxification, protection, and in certain cases, treatment. We've similarly looked at glutathione and pancreatitis, showing that enormous levels of free radicals are produced and the need for high glutathione levels to combat this. We've seen that not only is glutathione depleted in inflammatory bowel disease, including ulcerative colitis and Crohn's disease, but that measuring glutathione can also be used to monitor the patient's progress. And finally, the role of glutathione in celiac disease, where we see the high degree of oxidative stress and low levels of glutathione. So thank you so much for your attention. I remind you, there's a whole chapter on digestive diseases in my last book, which you could find on Amazon or on www.glutathione.org. And of course, you can access many more of these lectures on my YouTube channel, Dr. Jimmy Gutman, and new articles all the time on glutathione research on my Facebook page.